There we go. We are live. All right. Dr. Sanjay, thank you again. I know you had patience all day, and I know that you're just, finishing up your work day kind of to be on this show. So I really appreciate you taking this time to come and speak with us. And, I just want to let you know too that I kind of stumbled across your TikTok. I'm not a TikTok person, but I stumbled across your TikTok page about a year and a half ago as a fairly recent breast cancer survivor.
Oh,
And
wow.
what struck me was how you could take something as serious as cancer and made me laugh, and I thought, gee, that's magical. And I really appreciate what you do, and that's why I'm so happy to be doing this interview to find out more about how you started doing that and taking that approach. And because I know for me, it took the teeth out of what I was going through. Again, it's still serious. It's still a serious topic, but it took that huge fear factor out of what I was going through. So I really appreciate you from that standpoint. So why don't you tell us who you are? I mean, those of us who follow you know who you are, but just for our audience who may not know you, just give us a little bit of your background.
Well, first of all, I'm very humbled to hear that story. Like we've exchanged a couple of emails, but that it inspires me. It makes me a little teary to hear that. Just because, like you said, it's just so important. So, with that said, and we'll get more to that in a second, but I'm Sanjay Juneja. I'm a blood and cancer specialist. My wife and I both are cancer specialists, actually in Baton Rouge, Louisiana. And I, serendipitously, for the most part, ended up wanting to kind of provide education and information on social media. I ended up having one video that was nothing medical related that went, quote unquote viral, and kind of grew up always learning, like, any fruits that come into your life, like, if it's in vain, you keep them, but if it's with purpose and you listen, there's a reason you were given them, so you got to amplify it. So that's what I kind of took social media to be, and it's kind of led to me speaking a lot, I guess nationally, and again, humbly so, about both education, breaking topics down that are still scary, but become a little less scary when you kind of understand, on a more relatable aspect. And it led to different ventures. And one of those things we had mentioned before is Medfluencers, which basically is the same thing, but it's kind of a coalition of specialists doing the same thing in their different industries and everything like that. But more importantly, the key goal and my passion is just to, like, the healthcare system has a lot of things, like, it's, that make it hard to keep up, especially with cancer, with the number of treatments and testing and, the amount of time getting less and less that you can spend with an oncologist. I just think that's so tragic, for lack of a better word, because what could be scarier, arguably, than a cancer diagnosis, and now we have these platforms to help evergreen, recyclable information. A lot of times you have to hear the same thing 3 times, just to understand what type of breast cancer you have. Why are we doing this treatment again? I thought I already took it out, or I have a cancer. You said it's curable. Why are we not taking it out? And why am I on treatment? I'm leaving a cancer in. Like, these things are terrifying, unless you hear twice and thrice and whatever the four-time word is in Latin, to hopefully then kind of, help at least that difficult process.
Yeah, I mean, thank you for explaining that. You've amassed a huge following on social media. I think on TikTok you have like almost 500,000 followers because, as you said, you're able to take very complicated matters and and simplify it for the audience, make it more accessible in plain language. When did you know you had this skill? Was it in med school? Was it?
Yeah, no.
Is this in you?
I think, you learn as a physician or pre-med, like, it's called practicing for a reason. I always think it's not just practicing for the medical aspect, but like the humanism, the empathy, the awareness, the body language, the compassion, like all those things continue to evolve over time too. And so I definitely don't know that I was like, anything quote unquote gifted on being able to share information or breaking it down per se. But it's gotten stronger over time. I do joke, but it's kind of true. Like, I always say, like, I'm a layman or a blue collar person with a medical degree. Like, I grew up, I didn't decide to do medicine or consider it until high school. I got in a bad car accident. It's kind of a long story, but I always wanted to be a teacher. So it was a nice bridge of still being able to be that middle school science teacher that I wanted, but be able to explain things that are really, I think, important to make something very scary less scary. So it's always a work in progress. I always try to come up with analogies that are relatable in a way that, you know, regardless of what your background is or industry is, I just solely believe and see every day that when people like just become aware, are told and do justice, given due diligence on being explained about something scary, like
Yes.
people just wrap their head around it in ways that I'm inspired by every day, that I hope that I'm that strong. But I see it every day over and over and over again. It's the explanation, the understanding, the tempering of expectations. Those make a whole different, you know, journey than someone that's just kind of in the dark and doesn't really have an idea. And it's like cancer's already scary enough, right?
Right.
And a lot of times you want to be the best support person for a loved one with cancer. And then you don't really always know what to say. You're like, oh, I'll be fine and you'll beat it. Like, is that the right thing to say? And I'm sure they feel guilt. They're like, I don't know what else to say. So it's just, it plagues all of us. It's super common. It's a thing that's, you know, just happening more with more incidents. We need to just talk about it and come together about it and understand the reality, but also make the process easier because we're all finite. Like, that's what I always say. I'm like, I have no idea when my expiration date is, but you know, seeing what I see, it always makes me think in basically a 6 to 18 month term of my life, because I'm like, I just don't know. So what do you want your life to look like in 6 to 18 months as far as your purpose, you as a father in my case, and things like that. And I think to be able to have people with cancer also focus on those things and less about the Googling all the time and unsure, it's a humbling position to be able to be in, to be able to provide that and foster that, hopefully.
You know, when you said that about the 6 to 18 month window, you know, I was listening to something recently and it was talking about, you know, people who you have a diagnosis and you're told you may have 5 years, you may have this, you may have that, whatever you may have. But the truth is, if you don't have a diagnosis, you still don't know how many years you have. Just like what you just said, it's so beautiful, it's said. And I think the reason why you're able to say that is because you deal with it so much. You see normal, healthy looking people get up one day and they have a diagnosis, right? And they didn't see it coming. So I really, you know, you appreciate you just saying that. And from a medical perspective, and with your plain language, we are total health. Actually, my scientist guy is actually my science guy is on the line right now. He takes our, you know, we do all these conferences every year, and he's able to take the slides and the videos that these doctors, you know, oncologists present and really make them into plain language summaries, which we call education on the go. So I understand exactly where you're coming from. And again, as a survivor myself, for me, knowledge is key. I want the truth, but let me make it digestible for me. So
Yeah.
I appreciate your mission and
No,
what you're doing.
and I appreciate you saying that, because like it's like you said, at a diagnosis, if you say like, you know, 15% or 20% make it at 5 years, which now really that language should be very much changed, just with precision therapy, target therapy, things are so much more specific to you. But even if that was the case, say you're worried in that 5 years of being in that 15% at the 5 year mark alive, which again, nobody should be using those terms really without extra data. But if you spent it worried the whole
Right.
time about being in that 15% because you weren't really given, like, dude, you don't know how big of a victory this is. Like, you have a complete like response. Like, what does that mean? What is the duration of that response? Like with this, then all of a sudden you can take, hopefully, I hope, a
Yeah.
backseat less about the worry day to day, week to week, and enjoy month to month. So it's like it's sometimes even the education doesn't change how long someone lives necessarily, but it could change the entire way they are living while they live. And again, to your point, I learned that being so close to it. I'm like, I don't plan in 3 to 5 years, 7 years, because it's almost irreverent, because it's saying like, I
Right.
know I'm owed those days, right? And people that are surviving with cancer now, I learned on social media, surviving is a day of diagnosis. They're like, the next day you're surviving with it, the next month, the
Right.
next year, whether it's curable, whether it's not, you are surviving. And now people are saying like, I like thriving. So they're considered thrivers, thriving in spite of something so daunting and scary to most. I mean, that's what inspires me. But yeah, so we could talk about that all day.
You mentioned a key word. You know, you mentioned the word purpose, which I find to be. I interview a lot of people here on Tea Talks. You know, people with stage 4, people who have just had some really serious, you know, serious cancers, but they're extremely positive. They're very inspiring. But the common theme with all of these folks, though, when they got their diagnosis, I think they became more purposeful, and they began to live for something bigger than themselves. So I can see when you mentioned purpose, in your case, you want to live your 6 to 18 month buckets purposefully, and I think that's what you're doing. One thing I was curious about. So I have a bit of a legal background, and I know that legal advertising, legal social media is very restricted. I was curious as to how do you guys have, like, in the medical community, do you have like these compliance issues where you can and cannot stay online? Is it the same for medical as it is for law, where there's a lot of a clamping down on the law as to what you can and cannot say in your advertising? As I'm looking at your Medfluencers page and the agency that you're doing, and I think it mentioned that you had a lot of the compliance stuff, and so can you talk a little bit about that?
Yeah.
I'm
Yeah. And
curious.
the one, I have a very supportive team here. Like, they're very innovative. Like, the cancer center I work at, Mary Perkins Cancer Center and Veterans General, they're very, about community outreach. And same with our Mayor Broom, and Governor John Bell Edwards. Like, I'm on webinars often, literally sharing the same information I share on social media, right? Like, the webinars are public. We want to educate people on prostate cancer screening, lung cancer screening, the updates basically on treatments. So it's done. It seems like this whole what platform is on is somehow, even if the content's the same, somehow feels more nebulous or enigmatic.
Right.
But to answer your question, I mean, there are definitely things that you want to take in place. So this is more for the person that's thinking about doing it. It's institutionally, there's things that you want to basically check into, with Medfluencers and with myself personally with the LLC. I feel like I was blessed with the education ability to be a cancer doctor, to speak and explain things for not just the patients inside, but the patients also on the outside, which I'm saying the same things and want to be able to recycle that. So for that reason, I had to spend a ton on legal fees, as something I know about, to make sure that those compliance places those pieces are in place, what the language is. There's a little workshop at ASCO that they had last 2 years, which is dedicated, and we do it at the Oncology Society meetings nationally too. There's a breast oncologist friend of mine to say how things should be said. So ASCO actually supports, and they had this workshop on saying this is how physicians can educate on social media. This is the ways that you want to de-identify and stuff to remove the liability, hoping that it's for a bigger purpose. The problem is, like anything, there are people that are maybe doing it in vain, maybe doing it for, a lot of people are monetizing. They have these products now that they have big followings, and they're like, so this supplement will keep you alive. So that gets really sticky. I think as long as you constantly re-engage with your ethical compass, and of course have med mal, all this stuff for your LLC and stuff, which is important. You have to do due diligence. And Medfluencers, we vet people to make sure they are meaning well, so that we can make sure they have the legal stuff in place as well. I mean, everyone should, but to your point, and maybe it's a little blind trust or faith, but it's I believe, call it celestial. If you truly mean well, I mean, it's almost a daily reevaluation. Are you doing it for yourself? Are you doing it for others? Then you have to, there's some part of just having faith on what purpose drives you. And for me, I think I just constantly am reminded of this big need. We talk about being less scary with cancer stuff, but now the treatments and testing are updating so fast that the literature is showing us that drugs are being underutilized that are so novel and insane because people don't know about them. And the testing, in stage 4 colorectal, there's a test with AI that can tell you, should I get FOLFOX first or FOLFIRI first? And then apparently there's a suggestion that the survivals are significantly different depending on which one you do first. That's not even how we think in oncology. We always think about treatment 1, treatment 2, and you pick one. And now there's all technology that's people live longer based on this testing, and they're coming out from all over the place. How do you keep up on that? And I believe a lot of that is patient empowerment. So DTC is what the market calls it, but it's I hope every oncologist is humble enough, like I am, to say, if a patient brings me something on, out of the bottom of their purse and it's crumbled up, I will look at that paper. I don't know everything about everything. Any oncologist that asserts that, you'd have to take a hard look at. So it's we just need to team up. It needs to not be so patriarchal or matriarchal, as in I know everything, patient can't be involved. It needs to be more collaborative, because there's overwhelming data that shows, in community practices especially, that it's hard to keep up. It's hard to keep up on knowing when to retest, on what options are out there, what is the best thing for the patient. And I think it is only respectful to listen to patients, and nobody's going to care about their cancer as much as the patient and the patient's family, right? So that's the big tool that I think in social media I've gotten, I mean, dozens, if not hundreds of comments of like, oh, because of your video, we actually tested my cancer for XYZ. I was told, fourth line chemo or hospice, and then I was, candidate for this. I mean, they're miraculous stories that at first you're like, oh, this is great. And all of a sudden you're like, this is really concerning. Like, why is why is social media changing the outcome of somebody's like treatment options and stuff that could have been missed in 2023, right? We have so much technology, but the system really, it's just going to take some time to integrate all the kind of background stuff to make sure everything is uniform and democratized.
Yeah,
but that's a whole another conversation.
I mean, I could talk more about Medfluencers, but I also want to talk about the AI, because that's blowing my mind too. So my next question, right? You're the new generation of oncology doctor. You not only have the benefit of all the incredible advances in the last decade, like you just said, but you have tools for personalized medicine and now AI. Now, are you involved with the Journal of AI in Oncology? Are you involved in that in any way?
I'm on the editorial board.
Okay, can you talk a little bit about that? Because and AI has two reactions, right? From patients, from people, trusting and then scared.
Yeah.
Is it accurate? Is it not? Is it the next best thing in where we're going with cancer, or can it be trusted? So what are your thoughts on that?
Let me say this very, very, simply to start. And to answer your question, it is called it's AI and precision oncology. So it's like, Google's Seth Penberthy, he works for Google. We have Doug Flora, he's up in Ohio. These are very big kind of people that are passionate about cancer and cancer care. David Penberthy. And it's really picked up a lot in Storm on like trying to like explain exactly what you're saying. The number one problem is not enough like humility about the fact that like AI is not a binary thing. It's not like a computer taking care of all your healthcare or not. Like buy into a computer doing everything or not. That is not what AI is, right? There are so many shades of AI that to make a decision on all of it it's almost crazy. It's basically rejecting all of traditional like medicine versus like all complementary and alternative. I believe in both, right? There's a role for metformin and traditional medicine and seeing a doctor. There's also a role for acupuncture and meditation, all this stuff. It's the same thing with AI. One of the simplest examples I'll give you is on my podcast, it's called Target Cancer Podcast, and we had I had Dr. Michael Byrne. So he's a GI doctor up in Vancouver. When we do endoscopies and colonoscopies and we're looking for certain lesions and polyps, there is a percentage success rate on like identifying even a benign adenoma, right? Like meaning it could become cancer later. That rate is not 90+%. It's not 100%. It's not even over 80%. It's something I believe like 65, 70%. So we know that by a human, like they're missed, right? Because you're looking at a camera. You're at the mercy of that one person at that one time. If you do a pill cam, you have 4 hours of film that if it says, oh, your pill cam didn't show a source of bleeding, that also means at the mercy of whoever was looking at it after their procedures for those 4 hours of tape. I hate to be blunt, but like it's, ideally everyone looks at every single part of that film. AI, in this example, can query beforehand, okay, Sanjay's 35 years old, 36 years old. Sanjay's Indian. Sanjay, if I had diabetes, he has diabetes. And then they can query all of the different properties and idiosyncrasies and nuances that the data shows may make a sketchy polyp in me less classic or traditional. So that when you're doing this scope and colonoscopy and you have the AI assistance of knowing what your demographic, what your person is, what meds they're on, are they on reflux meds so it makes the mucosa darker? All of these things are actually now applying like during the visualization of that. And then it can tell you, hey, this is a high degree of suspicion. That is AI in screening or trying to identify a gastric cancer or colon cancer. So in that case, it's a question of like, oh, do we need something to really talk about what meds we are, who, how old they are and everything that may relate to a higher detection rate? or should we just let it be a 60% success rate? It's like, yes, of course, any patient ruling out cancer in their mother or father would like to have the things that relate to that person or individual applicable. That's one example of just one of AI. Imagine if AI ran the pill cam and actually studied every single thing based on knowing how your features may not look like obvious cancer because of what it knows about you. And then it goes to a doctor, right? Then it goes to a doctor. Like, it's not like it just says yes or no, but it's adjunctive, it's assistive.
Right.
And there are all these platforms. I use Xcures like just personally because I got involved in them early, but you can have combinations when you have patients in good performance status, but there's just nothing else, you've gone through fourth or fifth line.
Mm-hmm.
Imagine if there was a way to query every single case study that showed that the person with the same fingerprint and blueprint of your cancer, the same series of drugs they received. Imagine if you could query every case report of what worked, some random combination of oral pills that usually aren't chemo, and see if it had an effect. You can. That's what AI does. And so I've gotten like combos when there's nothing left, right, other than some intense chemotherapy, where then you have the data to be able to support it. I don't know how every oncologist would find it. And the AI software said, this may work in this patient because of all these features and all these things they've gotten before. Here's 7 reports from around the world that show that this combination gave them 3 months of disease control. Like, you have to be an oncologist that says, I can do that all by myself to not do it, right? It didn't force the patient to take the treatments, but it gave it to me and helped me narrow it. And then I dug further and I'm like, wow, this thing looks like it really works. You have the same mechanism of resistance, and this is why you progressed on your other oral pill, but it sounds like if we use these two, it overcomes it. I learned all that because I had nothing left and an AI software was able to look into it. So these are 2 very low lift examples of how integration of AI is not replacement of a physician. They're tools in a very rapidly evolving space that basically make up for human error. And if you believe in a divinity of any kind, we are of error. So it's just an extra layer of protection for that, in my opinion.
Something that you said that really made AI made sense to me in this context. When you said, you have regular traditional treatment, you have the integrative stuff, you have the alternative stuff. I mean, there are all these different, access points, right, to how people receive treatment. And you just said, AI is just another thing. And I think when you said it that way, it all of a sudden it's like, oh, okay. For me, that is, I was like, oh, okay. It's just like me. I'm from the Caribbean, right? So we're eating soursop, we're eating all these things for cancer too. It's just another thing. And it may or may not work in our case, but when you put it that way, as AI is just one more thing in the toolbox, that makes sense. All right, there's some questions that's been in the comments. I'm gonna have to take some of these. Okay, let's see.
I mean, to use your example, if you're like Jamaican and your diet and stuff, if on a colonoscopy, something that would look normal, if like the AI beforehand knew all that, it would say, hey, 20% of these look normal, but in the Jamaican population that eats this diet, this is considered an early polyp or precancer. That's what the AI would aid you in during that colonoscopy. Like, that's what they're doing. This is what reality is already. It's able to say, you would think this is normal, or you would think this is within the realm of normal, but then it looks like in this population with this medications, it's found that 60% are actually not normal. You would know that in real time. It's just an aid, Sorry, go ahead. Let's see it.
Yeah, no, but that's good. That's even further clarifying it because, I know that different, so something Sarah talks about all the time, that different people groups have, they're more prone to certain types of cancer. So I think with what you're saying, with AI would then, that would be another major plus, because you say if you're pumping in the data and saying, okay, this person's Black or, from the Caribbean or from this part of the world, then it would intelligently know.
It's narrowing exactly what is more relevant to that individual.
Yes.
That's AI all over it. Because how would the endoscopist know what drugs necessarily if they're scoping several people a day and what the unique features for that one drug randomly? But AI queries all that and tells you. I mean, it's crazy.
Dr. Sanjay, I think you need to do some more TikTok on the AI. Because
yes,
I think
that's coming up. That's my next quarter.
I think like that explanation for me, because I'm for ChatGPT. I use it for work, but when it came to my medicine, I wasn't sure. So, but I think you could really clarify that a little bit more in your TikToks. All right. So a couple questions. This AM on the Today Show, Jill Martin spoke about her breast cancer diagnosis to share it with millions of NBC viewers. She broke it down into such simple language and shared such important information. Her segment what you do on your channel and what Peter does for total health with his education on the go will change the way people deal with their diagnosis. No doubt this is such an
No.
important change. Yeah, totally. And I know you have other doctors as part of your Medfluencers. They're not just oncologists, they're in other fields as well, right? Yeah.
Everything, like it's ER, like some of it's designed to help other providers like learn stuff. Like in oncology, that's why Twitter became so famous. Now it's X. It's like we would just learn from other oncologists. So it's education that some of my most viral videos is how important iron deficiency is. I mean, even without anemia, it can cause restless legs, depression, decreased sex drive, like fatigue. All the data shows that. We know iron deficient women, adolescents, and young adults like have increased mortality. And then a study came out showing like up to 30% are just written off as depressed for their fatigue. So then we go over on TikTok. I'm like, hey, if the size of your red blood cell is small consistently, and the variation is high between the size, then you need an iron profile. It doesn't mean go take iron. Like that's the key on social media, because you don't want people to just go take iron if they're not deficient. But if they are, like you'll see now hundreds at this point comments because my restless legs are gone, and I was on 1 or 2 drugs that basically slowed down my central nervous system. I had no idea it was iron deficiency. So it's like, and now all of a sudden I had a lot of primary doctors like from just overextended communities. It's not they don't care. But if you're seeing 40 people a day just to meet the needs in the middle of the Midwest, it's hard to stay up. They're like, thank you for this stuff. Like I just never thought of it like that. My patient population is happier. Like it's nothing that I'm doing, for the record. It's nothing like, hey, this is just stuff we know, but it's just easy to slip through. So just keep it evergreen and let patients help. Especially in busier communities.
I have a question about the whole patient thing, but let me just take this point. Great point, China, about the legal aspects of this. I think a lot more physicians would be interested in this type of communication with their patients. If we can take the fear out of that and just do a disclaimer. What are your thoughts on that?
Yeah, so again, I had a lot of legal counsel, like for myself personally, and then with Medfluencers just to be safe. But I wish it was that easy. There's a lot of stuff, and the problem is it depends on where the board is also. So where your license matters, where the patient is licensed. So the disclaimers, it's good and it helps. Well, I don't know how much it helps. It's good and it means well, but definitely it's not enough, is what we've learned. At least on our legal background, there's a very fine way to have to de-identify and stay within the parameters that applies to most board settings. I mean, I don't want to call it sad, because there is some degree of regulation and responsibility that anyone has to have. And if people extrapolate something like out of it, like take it hyperbolically, like I said, this is what you need for iron deficiency because it can cause it. This is why you need an iron panel. Somebody just taking iron without getting the iron panel, like that's, there's a fine line between like what you're teaching and then what can be taken incorrectly. But to your point, it's tricky. It's hard. I think if people were less scared, we would learn more. The biggest challenge then would be the discernment between, like fact and fiction. But that's the case anyway. Like Google, there's no fact checker. It doesn't matter what you read. If it comes up, there's no factual. I saw a thing that Simon Cowell died yesterday, and I was like, oh no, Simon Cowell. And it was just like clickbait, right? And it came up on my Facebook somehow. So I was just like, but I think people are getting more comfortable because people are doing webinars and public facing stuff all the time, teaching also. Like how is doing it for the mayor or the governor at a big thing that's, either an event or a live webinar, like how is that different? If it's the same content, message the same way, outside of a government or organizational, public video.
So I'm all about patient education, but there is a balance, I think, right? So when a patient is newly diagnosed, what do you think is the first thing they should do? We're living in the era of patient centricity. How should we balance what patients should and can handle while dealing with the trauma of a diagnosis? And for me, personally, it is true. In this, it's a patient-centric world, but there's a balance still, because not everyone, I think, can handle that information. What do you think? What is the first thing that a patient should do?
Which information specifically?
I'm sorry?
You said you're not sure if they can handle that information. Which information specifically?
Well, sometimes, okay, for example, we talked about like, what's your probability? because you want honesty, right? So there's a balance between honesty, being honest and saying, well, your prognosis looks pretty bad, and hope, well, there's a new drug coming out, or clinical trial over here. I know in the culture again that I'm from, it's changing a little bit now, but the culture was more of a denial culture. Like, let's not do any tests. When it happens, we'll know then. That's changing somewhat with all this education. Like, well, maybe if you're tested earlier and you're discovered earlier, there's no cure like you would say on your shows, but boy, there's a better chance, right? So I think educating the community, educating patients is really it's really making a dent in like those diagnostic stuff that we're doing now, and taking us out of the dark ages again, culturally speaking, where it's a don't check, don't know. Now we're checking a lot more and we're knowing a lot more, but sometimes knowing may be too much as you're dealing with the diagnosis.
Yeah.
It's really fine line.
Yeah. So
I'll just say the one thing, Sanjay. Someone asked me recently, how do I work at Total Health? Because this is what I do. I talk to oncologists all day long. I go to the ASCO meetings, and I've talked to survivors on this show. 3 days a week I'm on the show. And someone asked me, how do you deal with that as a survivor? And I said, truthfully, I used to look at it 2 years ago as I don't want to know too much. But now I look at it differently. Like, now I want to know. I want to know what's working, what's not working, because I believe that knowledge gives you that upper hand. I have a daughter and a granddaughter, so I want to know what's coming out, what's coming out. What are these tests available? So it just depends. But for some people, it will be the flip side. It's too TMI. So
yeah,
and that's the reason why I think when I looked at your TikTok, I was learning, but I was also laughing.
Yeah.
That's what I'm saying. And so it was so different just to see you doing all of that as an oncologist. We look at oncologists as very serious people, and it's usually bad news. But when I watch your TikTok, it was digestible for me. And it was like, oh, okay, I'm learning, and I'm not scared.
Yeah. Yeah. And that's a focus of mine. And I think it's, unfortunately, that's kind of user dependent as far as the person sharing the information or even the oncologist. But for me, there's a couple of overarching themes here. Number one, I love to celebrate victories. Like, I love that anyone with a cancer diagnosis is a survivor from day one, whether it's stage 3, 2, 1, or stage 4, you're surviving something. Number two, it's very easy, and I try to always bring in my patients when this becomes an issue to think like, what's gonna happen in 3, what's gonna happen in 5? And I don't want to be so rude as to be like, well, I don't know if I'll be live, because that sounds almost offensive. I would never say that. They've heard that from other doctors, but it's like, and I don't think anyone means anything by it, but I know how that almost seems like, well, you have a uterine cancer. I want to celebrate all the victories. Like, number one, if you tolerated your treatment, I tell them on day one, I'm like, that's a victory. I'm like, because this is first line. And if you don't tolerate it, you get some crazy rash, your liver numbers go crazy. I'm like, that's unfortunately like going to be challenging. I'm like, so that's a victory right there. I'm like, I need us to celebrate our victories and think one step ahead. Like, what's the next big challenge? That's what brought me to medicine, is because I lost my eyesight temporarily, like in a bad car accident. And everyone's like, weren't you terrified you'd never get it back, never see, or big athlete, whatever. And I was like, no, I wasn't. And I don't know why. And I'm like, was I crazy? Like, why wasn't I worried? And it's because my doctor, Dr. Grenier, would always tell me, this is why you can't see. This is the pressure. This is pushing on your retina. That's what basically gives the blood supply to being able to get the vision. And so I found out what my victories were. If the pressure was 38, he's like, I want to see below 30. And so I get it below 30. This is why you're dilating. Because I hated that I was dilating, because I saw literally even worse, and it hurt because I had really bad iritis with the steroid. But everything that was taught, I was just like, I was goal motivated. So it's like, that's the key, you tolerate the treatment, your first scan, like, how meaningful is it when you get that first scan? If you have a response, it's huge. Anyone telling you a survival, if they ask me on day one, I always say, if I may, I was like, I can tell you responding into first line treatment, maybe 60 to 70%. So odds are good. And I'm like, then we can talk about it if you really want to at the first scan to see if you were in that bucket or not. Because if I tell you at the beginning what the survival is, it diverges hugely based on whether the person responded to the first line treatment or not. Because usually the first line treatment is the one that makes a big difference on disease control. If you fail that first one, it's a whole different bucket. So I said it'd be inappropriate for me to tell you this now, because for 6 to 8 weeks, like, you know, if you do respond, then the statistics are more in your favor. If you don't respond, I gave you false hope because like you're actually in a much worse bucket. I'm like, so let's just have our goal, and it seems to do well. So it's like that's what my TikToks are for. It's not, you know, I don't have material which is like, hey, this cancer is really terrible and this is, look at this abysmal survival. But it's more like, you know, these are the exciting things in GBM, which is really terrifying. On my podcast, I had a guy with this company that like they're finding these crazy ways to like basically treat GBM and childhood DIPG, which is like a terrible disease like GBM. And now it's like it's fully trial available for anyone refractory or relapsed GBM or any child with DIPG. And it's technology that's completely not surgery or radiation. So it's like similarly with TikTok, I was like, I want to give hope. I want to make sure that all options are being explored. And then also to help understand the victories. Guess what? Immune therapy works really well in this. Guess what? Another tumor marker has come out, you know, in this cancer type that like we're able to attack. So like these are things that hopefully like can help aid and strengthen someone's course. But they're just mostly adjunctive, I guess, in the same way as AI. Like I just like if it's there and you want to learn more about it, you know, here it is. But certainly I think it's difficult or challenging for the thought of like I don't want to think about it coming back, or I can't speak on it. I've never been there. You can. I will say on my podcast, we're about to have our 50th episode, and I had 3 different cancer survivors that are doing a lot on social media to help other people. And it was weird, but towards the hour and a half, which is longer than ever on the podcast, they all kind of nodded when they were like, I think at some point during my treatment, I came to grips with the fact of like I could die. And like they all said that, and they just all chimed in, and they were like, I think that's when things started changing. It's like at some point you just come to terms that like it may not work out, whatever. And they're like, at least those 3 were like, and somehow, like I think God, you know, divinity, whatever, like strengthened us. When that's accepted, that's when people start thriving, like is what they said. That's why they call it thrivers. And I think you get there knowing the statistics, not as far as like what applies to the one person. Those days really should be over. I'm not just saying that because we're in precision molecular therapy. If you Google something about how long do people live with this right now, I can't tell you how many targeted, novel, crazy tech drugs with immune therapy, with targeted therapy, all these things have come out in the last 3 or 5 years. How could you get a statistic about 5 or 10 year survival if they just came out in the last 5 years?
Right.
That's what I want anyone to hear. You're going with stuff that if it's telling you 5 or 10 years, that have been around for 5 or 10 years. And guess what? That's a lot of the stuff, especially in metastatic setting, that have just totally changed how long people live with cancer now. That's not including those things. And the second thing is, and this I could only say for the last 2 or 3 years, but I mean it. Now in the world that we live in, if I gave you a survival, let's say you responded well to immune therapy in first line, and I'm like, you know, 50% are alive in 2.5 years. That requires cancer and technology and therapies to freeze for you to be in 2.5 years. That means that nothing else comes out for you. That means all the progress we've made in the last 3 to 5 years, that you live in 2 years, that's only if all of progress froze. And I'm like, guess what? If you look at the thing, like at the graph, it's absurd how many first line treatments have been replaced with something new. So I'm like, our goal is like, I want to keep you alive and well at a year, and I don't know what's going to come out in that year. I'm like, but I want you to live it up. You let me stress about finding what's new, what's next, what's in the queue if we're to progress and when and reset it. But I'm like, you live maximally. Your oncologist is supposed to like stress about as much as they can about it so that you don't have to. And it's just almost dense because it requires 3 to 5 years to say all progress has stopped if somebody's giving you an assessment of what's going to happen in 3 to 5 years. Because do they know what's going to come out, what mutations can be discovered? And I think that somehow is like all of a sudden reassuring because, again, people are living years with things they never did. Melanoma, renal cell, like these things that were just terrible. It's like because of immune therapy and stuff, it's unbelievable. And then who knows what's next in 6 months? That's my goal, is like keep you alive and well, because I don't know when the next silver bullet's coming, you know?
Your optimism is just amazing. And it reminds me of a patient, of a woman I had. I don't want to call her a patient because she would not like that. It's a thriver, stage 4 metastatic breast cancer woman. She said, she was on the show a couple weeks ago, and she said, "Look, 5 years ago or 7 years ago, when I was first diagnosed, I got a particular drug that had just come out 2 months prior, and so she had a little bit of a recurrence, or there was something going on, so she had to start chemo again. And she says, I'm not worried because every day something new is coming out." And I got to tell her, she was so inspiring. She was so positive, and she's doing a lot of stuff. She's just an amazing woman. But just exactly what you said, unless everything freezes, we don't know what's in the pipeline coming down. So before we go, last question. Well, before that, I'm actually happy to talk about real quick too. We are creating our own compass journey map here at Total Health for the journey. We're going to be mapping these different cancers, putting the information in people's hands. Where, all right, you get diagnosed. Here's what the next step should be. Here's what you could ask your doctor. And if you are a person, of underrepresented group, and there's some financial challenges or other boundaries or other, barriers, I should say, then you can click on our map and it will show you like, okay, if you're looking for, let's say, financial health, go here. If you're looking for X, go here. So it's called our compass journey map. So stay tuned. It's coming soon. But finally, Doc, how do you avoid burnout? I read one of your posts recently. You were talking about, I think might have been medical students. And you were saying we should take care of them because they're going through so many mental and just, it's tiring. And if we don't take care of them, how are they going to take care of us later on? I thought it was very powerful because I never thought of medical students that way. But it was a good post. I forgot where I read it. One of your platforms. But how do you worked all day? You're on our show. You're on many shows. You have your podcast. You're doing so much. I'm glad to know your wife is also an oncologist because she will understand your crazy schedule. But how do you avoid burnout?
To be honest, I don't. First of all, I'm not burnt out, but I do have concerns. I don't know how one doesn't feel the weight. So I'm like 2 or 3, years in, and I can see how it gets challenging. I just do, and I can't say that I don't. I mean, my wife and I cry at least once a week, right? Like sharing a story with each other about something. I don't want to stop caring. I'd rather stop practicing before I stop caring to make it affect me that much. But it's not. There's a lot of support needing still to be done to help, because there's this concept of moral injury, which really hit me. And that means that doctors or clinicians or whoever are constantly met with re-challenging or absorbing moral injury. And that means that every time, I want to see my kids need to see their dad, I have a choice every day. Do I call the prior off and make sure that the thing gets approved because that's what I wanted my dad, so it's sooner? Or do I just say it's the system and they'll figure it out when it's figured out? Or do I call for the biopsy? Do I call to get the records from something I didn't know about in my visit because it wasn't in my template? All of those are choices. Mm-hmm. And right now, my kids are taking a big hit for that, right? Both of our kids are. But I will always make that choice now, because it's the right thing to do. But when people say that doctors are, maybe colder, doesn't explain, doesn't care, callous, I always try to say just please give the grace of at least I don't it could be a defense mechanism. It could be, it's a challenging, something's being sacrificed. Unless you're not full time. If you're full time, and you want to care for your family member, yourself, to be like they would treat their family, there's plenty of unaccounted, unbilled, unblocked off time. And that's not unique to here, to there, to yonder. That's the healthcare system in this country. If you want to make the calls and make sure things are sped up and talk to the other surgeon, I have an amazing team here. I'm talking to my ENT person, my radon person, everything way after 5 or 6. But I think about they have children too. They're not home, neither am I. But that's the extent you do until we find things that are, I think, more AI enabled. I think tools that help workflows and automation are wildly somehow not implemented, which blows my mind because the tech world is so insane. But one thing I want to say is, your oncologists may seem that way because I hear that a lot on my social media, but it doesn't mean they don't care. I promise you, I know oncologists that maybe don't say the most up front, but they are working for you in the background, for the most part, if I had to guess. So number one, just note that it's not always outward. And number two, and I think this is kind of a key thing. When I was in pre-med, somebody had said she was a neonatal intensivist, actually in town because I was at LSU. And she said, a lot of times I get asked the question, why would you want to be a neonatal intensivist? That's depressing. Isn't it hard? You see babies die. You tell their family, that they can't, whatever. And she was like, and I learned, and I've always felt this way since, that life isn't always about what you want to do, but if there's a need, I'm getting choky when I say this, but if there's a need for something in the world and you can do it, and there are some that can't, then you should. And like, that's what drives me, right? Is like people are scared of cancer. People, like, at the end of the day, like, need to feel trust and support and care and reassurance. And it's like, is it easy? Not all the time, but it's necessary. So like,
Well said, Doc.
so if you can, do, and then if you can't, don't. Like, and I think that's why people burn out. There was an oncologist at Mount Sinai that committed suicide over the weekend, and it's just like it's physicians jumped veterans, which that breaks my heart too. I think veterans are very, very unsupported in this, like in the VA system. That's a different thing. Now I'm in big trouble because somehow Big Brother heard that. But physician suicide jumped veteran suicide, I think 2 years ago, as the highest interprofessional suicide rate of any profession in the country. But the moment you talk about it, like anyone says, like, oh, why aren't you talking about XYZ? Why aren't you talking about this other stuff? It's like, you can't even talk about it because it's like, you don't even feel like you have the right, even though it's the number one, because it's just very like, well, what about those, that you support? Like, I would support other things, and I got to figure that out for it on a personal level and see what can happen. It is very challenging. I'm glad you asked it, and I think it's an issue, but I hope it gives also grace and understanding. We're all one, like doctors, patients, like all this stuff, like support staff, like nurse staff. I just think of it as all one, and I'm like, the more we can not kind of divide and just realize it's like we're all trying to do literally the best we can with a ton of holds, like patients hold, I hold, everyone holds, and everyone is in a very constantly stalling kind of system until it speeds up with automation and all this stuff, and we're all in it together. And I think giving all of us more grace, if your patient misses an appointment, if they didn't take their meds, like, we could just all give more grace across the board, I think, from all sides. And I think that's the quickest way to make up for what a system otherwise obviously has a lot of evidence for burnout and then difficulty with, with that kind of thing.
You sound like a man of faith. You use the word grace a lot, but, and so for me, I just picked that up. But anyway, I don't know if you are or not, but you're right. Because in explaining that, you're right. People do, we make these assumptions, right? My oncologist doesn't care. He gave me 15 minutes. But you're right. We don't look at the human element. We don't look at the human side of what they're dealing with as well. We try at our conferences, every conference that we have, we make sure we integrate a wellness piece for the physicians and all the clinicians, because we recognize that there are two sides to it. And so, but I don't think people hear it enough, because it's hard to say, hey, I'm tired. People don't want to hear that you're tired. They want to hear that you're on all the time. But the truth is, you do get tired and you do get burnt out too. And that's about the suicide. I mean, that's.
No. I mean, I read this thing, or maybe I was going to write it. It's like, because I had such a challenging day a while back, and like I was like, being an oncologist is literally going into one room, absolutely wrecking someone's world and their family, wrecking it, and being the one to do it, and then having to just like walk out, text back like your friends for asking why didn't reply in the last hour, and then go into your next room smiling and happy about like the scan. Like, it's the amount of emotional checking that's just expected. Like, somebody was, they're like, oh, what took so long? And I actually explained, I was like, oh, I had this, very young patient that's dying, and like I needed to whatever, and like it's just, but you just constantly feel like you're under, like, disappointing to some degree, everyone, right? The patient wants more time. The like, you wish you could do more. There's always some guilt, even if a patient had a survival twice as long on average, if they were in the 99th percentile, that last scan where it's like, we've had this great run, there's always a piece of guilt, at least for me as an oncologist, as if I failed, even though it was metastatic from the day it started. It was never curable, and we're way past that. But there's like, part of me feels guilt every time, as if, and maybe everyone doesn't. Maybe I need to figure that out. Maybe I'm sharing way too much on public, like, live thing. But like, I do think it's the best version of me, and I know my wife agrees, to care to that extent. I don't know how sustainable it is like without some kind of something for that. Like I said,
Yeah.
you see 20 patients, you give devastating news, you suck it up, and you smile on the next one, then you do the heme visit, and then you apologize to everyone for not seeing the inpatient fast enough or not answering. It's just constantly like, you're just constantly like, I'm sorry, I'm sorry. You're just apologizing all the time. It's like, and then you want to spend more time, like to like be there a little longer for the patient, and then you're apologizing for the rest of the day to every other patient that got bumped back by 10 minutes, and to the inpatient because you still hasn't seen the consult, still didn't call back to the pathologist. Like, it's crazy. That's every day. It's every day.
You know, you just take it for granted. You know, you see doctors as non-humans. You know, people just because when they do see you, they're in such a desperate place themselves. They don't see you as anything but a doctor who needs to fix this. But again, and this is not something you can do on TikTok because nobody's going to be caring. But I certainly appreciate you sharing it here because it really, and hopefully for our audience, even on the replay and on YouTube and the other platforms, it really gives you a sense of like, all right, you're not asking for pity, but doctors are humans too, and you're the ones delivering the bad news. Let's face it, and have to go deliver some other news and still go home to your wife and your kids and have a life outside of work. So I
feel responsible for everything. Like, even if it's like, things happen across the country anywhere. CBC was an error on the test, or the molecular testing got lost. Like, whatever it is, if you care as a doctor, you take responsibility for that. Like, you tell the patient the molecular FedEx lost it, but you still feel bad because now the diagnosis is delayed by a week. And there's all these things, and again, an imperfect system. I'm very lucky, and we are here because we have a great team. Like, I can't imagine how people do it without a team that's like fosters like really just like love and respect for each other and all that stuff. But it's a hard system, and I think again that's where like all of us just like kind of marrying together on realizing the challenges of healthcare. It's doable because I do believe in inherent goodness. Maybe that's naive, and I think a lot of it just takes some sensitization to it. But we can get there. We are getting there. And a lot of the tech and automation and social media and the story sharing and what you're doing here, and it sounds like with Compass, all this stuff, that's why there's a lot to be done, but it will be done because I see the strength and ability of people every day. I mean, people just, when they say everyday people, it's like, that's such an offensive term because you see this amazing strength with a diagnosis of someone that you can imagine like having the same. And I have a lot of faith in people and us and all of us from what I get to see. So that's why that's why I can do oncology. That's why I chose it. That's why it is humbling, despite all those things that I mentioned, to be able to do that every day for another human being. Like, you'll learn something interesting about somebody. Like, if you dig, it doesn't matter where, in the shopping center, in the bus. And if we did that more, I think we would just have so much more empathy with one another. And we have that, like here, and y'all do it here with telehealth. So anyway, got me all in my feels today. This is supposed to be a straightforward social media talk.
No, I'm really glad you shared that. I'm gonna rewatch this actually too. I just think it puts a lot of thoughts in my head about even how we ramp up our wellness pieces at these conferences that we do, because you gave me. I'm actually heading to Memphis for one of these conferences that we have at Total Health. It just gave me a good perspective, because to look at the doctors again with just that renewed eye, because it's true. I mean, even though you do something and even though you offer these wellness, talks and stuff, it goes beyond that. You know what I'm saying? It really goes beyond that. So I really appreciate you being vulnerable and sharing that and being open about that. So I'm going to let you leave us with, this show is called T Talks, right? And it had to do with, Sarah came up with the name based on the T cells being our happy cells. So I would like you to leave me with something TikTokish or something to bring up the audience. Your final word, just your final thing that will enlighten our T cells today, or enliven them, or make them.
Okay, let's do two things. Well, number one, with cancer, just truly, I meant what I said. If you're thriving with cancer and you have disease control, like, any of those things, it's ridiculous what's coming out all the time. And if you feel some degree of discomfort, or like maybe there's more, like, I encourage you to just like do it. Like, find the AI platforms, like there's so many examples, do your research, but just don't leave things unturned. Like, I think that's very important because, again, we're all very finite. And I think having a gut feeling unresolved, even if you're a care provider, right, and you feel bad about like want to do more, say more, just share. I think my big message is just share and speak up in general. Life is too short. If it's sharing with your oncologist, if it's sharing with the caregiver that maybe is making your journey more stressful, but they mean well, so you're biting your tongue, which is ridiculous and amazing because you're the one with cancer and you're such a strong person. And yet I know these cancer survivors absorb a lot just because they don't want to upset the people that love them because they've come to terms with dying. I mean, it's like the number of layers of humility are insane. But I think if you're listening to this, share stuff, because I do think inherently we will always meet it with kindness as humans. Like, this is who we are. And I've seen that over and over again. And so that's an amazing thing. I didn't think even bigger though. I think that's what I have. I think it just share, just talk. Just whenever you think of the friend and you're like, I should text them, I should call them, just do it.
Just do it.
And that's it. That's what it is. It's
Nike.
Just do it.
We're gonna Nike, right? Just
That's
do it. Do
it.
Doc, thank you so much. Really, I appreciate it. On a personal level, just based on my own, journey. And I appreciate it on behalf of Total Health and our audience for sure. You sharing so wonderful, and the work that you do, the mission that you're on. I really appreciate you, and I wish you continued blessings and continued, favor in the work that you do.
It's for people like you. Y'all inspire me, inspire my wife, inspire, I admire you. Anyone listening, if you have cancer, you've thought it, anything like that, it's just that is, at the end of the day, to answer your question and like burn out all, it's like find your purpose. The world is always telling you, whether you believe in God, divinity, celestial, whatever. I believe the world has an inherent will to foster and set you up to like fulfill something that is like greater outward. And so like, I think, this call does that. I hope someone hearing this is like, I need to do more about something. Go do it. Just do it. Swish. And you and people, patients like you and people like you are definitely our inspo. So my inspo. Anyway, just do it.
Just do it.
Take care. Well, I'm sure we'll speak again.
Just do it. Thank you so much, Doc, and thank you guys for watching. Even if you're on the replay, put notes in. We'll circle back and answer them later on. Peter said thank you, but thank you so much. Really, he's going for it. He said he had it put in the feed, but I couldn't catch everything here. He's going for a colonoscopy. He was very intrigued by that whole AI stuff, but you'll see it in the feed later on if you go back. But thank you.
Target Cancer Podcast. That's the name of the podcast where I talk about all these tech things in the future.
Yes. All right. I'm going to end our broadcast.